preparing for disaster. This is a field hospital in Canada's largest city, one that doctors say will be in use soon. Good evening, I'm Hanomansing. Tonight, the last-ditch effort to slow the surge in Ontario and the warnings to prepare for the worst.
So effective immediately, we're extending the emergency declaration.
Critics say the new restrictions don't go far enough, as doctors on the front line warn this is a healthcare system on the brink.
I can't believe I'm saying these words. There would be people who will die who otherwise would have survived.
And fighting their own rising tides. Should other provinces be called on to help?
We just don't have the capacity.
We really don't have anything to spare to send to Ontario.
Also tonight, getting AstraZeneca off the shelves. The vaccine rollout hits a PR hurdle. And the final goodbye to the Queen's strength and stay.
She is saying farewell to someone to who she was married for 73 years.
Preparations for a prince's funeral. This is The National. Canada's upward trend of COVID-19 cases has never been so stark, and it's driven by a crisis in Ontario that officials said today could become a catastrophe. Across Canada, the 7-day average for new daily cases hit an all-time high today, more than 8,680. Since Monday, 290 more deaths.
Our children's hospitals are now admitting adults as patients, and this has never happened in Ontario before. It's never happened in Canada before.
And the number of new cases set another record for the province, more than 4,800 for the first time. Unprecedented levels also for COVID patients in hospital and in intensive care. Katie Nicholson begins our coverage in Toronto at the site of a makeshift care centre. And Katie, tell us more about that.
Yeah, so Ian, this is Sunnybrook Hospital's field hospital, 80 beds here. This is designed for people who are recovering from COVID, and it's to make space in those critical care units for the onslaught of patients that they're expecting. But as we learned today, these measures may not be enough.
Ontario's pandemic numbers have never been this bad.
It's hard. We're stretched. We're tired.
This doctor, already overloaded, now doing all she can to train more much-needed staff for intensive care.
I'm scared that we won't have enough people.
So under the scenarios...
And new modeling today shows the worst is yet to come.
And our progress is both frustrating and frightening.
With current measures in place, the numbers project by the end of May, 10,000 new COVID cases a day, more than double today's tally. Staring down the barrel of a COVID catastrophe, the province today extended the current stay-at-home order to 6 weeks.
And more needs to be done right now.
And announced new restrictions effective midnight. Non-essential construction for things like shopping centres and office towers will grind to a halt. Much construction will continue, including residential. Box store capacity now down to 25%. All playgrounds to close. No more golf, soccer, or basketball. Outdoor gatherings limited to one household. The Ontario border will close to Manitoba and Quebec, but remain open to workers who have to cross. And police will have enhanced power to crack down on people, even pulling cars over to make sure the trip is essential.
If you are not willing to comply, then you are breaking the law.
The fine for non-compliance? $750. Criticism came swift and sharp from the medical community.
We're implementing measures that are totally contrary to what public health is about and what the best experts are recommending we're doing. And so that unintended consequence would be, that this is going to disproportionately impact our racialized and vulnerable communities.
As field hospitals and treatment tents pop up in major centers, it's an open question who will tend to the patients in all those extra beds. Ontario has asked other provinces for help staffing. The Prime Minister says Ottawa can help with lab support and contact tracing.
For Ontario, we've shipped out more healthcare equipment, like oxygen units and drugs to treat COVID-19.
And they're ready to pitch in with more resources, including Red Cross teams to help distribute vaccines. But Ford says he doesn't need people. He needs vaccines.
And we're going to take a closer look at that claim in a moment with Rosemary Barton. But first, Katie, there's more criticism of Doug Ford's restrictions emerging tonight.
You know, Ian, none of the medical experts I've spoken to ever wanted to see playgrounds closed down. What they wanted to see was paid sick days for the precariously employed essential workers. They wanted to see factories shut down that aren't producing essential items. And the other thing we're hearing from is civil liberties organizations. They are worried that people of color are going to be disproportionately affected by these broadened police powers, and we may see a number of racial profiling incidents, or at least an increase in them as essential workers move on and go to work under these new conditions and get pulled over. Ian?
Katie Nicholson, just outside the temporary care centre outside Sunnybrook Hospital in Toronto. Healthcare workers have been speaking out throughout the pandemic. Today, an ICU doctor told CBC News Network about the fear that she and her colleagues may be forced to make gut-wrenching decisions about who gets life-saving care.
I can't believe I'm saying these words. I did not go into medical school and become a critical care physician to do this kind of work. And the moral distress that this is going to create for my colleagues and my profession as a whole is people will quit, people will leave, and this is going to be horrific and devastating for us all, but way more horrific for the patients and their families and their friends. It is affecting the most vulnerable in our society. It is affecting those with the least social capital to be able to speak up for themselves, those with the least amount of representation right now in cabinet and in government. And it's completely unmasked the inequities in our society. And I'm angry, and I'm sure you can see the anger in my voice. Yep. It is not the way I ever expected things to happen in this country.
Now, we heard Katie report a little earlier that Ontario has asked other provinces for help, and there are new calls today from Canada's Association of Doctors to redistribute vaccines across Canada to the hardest hit places. But as Cameron McIntosh shows us, other provinces are fighting their own battles.
All right, ready?
Next door to Ontario, Manitoba shut its borders 3 months ago. Still, the pace of vaccination isn't moving fast enough to outpace the variants. Now, officials say Manitobans need to decide how bad their third wave will be.
I think people should open their eyes. You know, we have in Ontario, if you see what's happening in Ontario.
So a plea, stay home, flatten transmission rates.
It's going to be incumbent upon all of us, you know, again, to make sure that we don't lock down. That's not our goal. Our goal is to have somewhat of a functioning society.
In many parts of the country, that's looking increasingly unlikely. The 7-day per capita average rate of infection is also climbing in Quebec and across the West. Alberta actually trending worse than Ontario now. The Canadian Medical Association is calling for a new strategy to deploy vaccines and personnel in areas of greatest need, rather than per capita or by province.
There will have to be gut-wrenching decisions made about who's going to get to live and who's not going to get to live.
A call backed by experts, particularly in problem areas.
We're all in this together as a country. We need to control the pandemic as a country.
Ontario is asking other provinces for people and equipment. The response so far for most provincial capitals?
We just don't have the capacity to start even talking about loaning our healthcare workers out.
We really don't have anything to spare to send to Ontario.
Same goes for vaccines. No province wanting to give up an edge, even where cases are still under control.
We need to stay on track with our vaccine rollouts.
As for the federal government, asked today, the Prime Minister said sharing resources, including vaccines, is up to the provinces. With each trying to put out their own fire, there seems little ability and appetite to do it. Cameron McIntosh, CBC News, Winnipeg.
So help isn't coming for Ontario from other provinces, and today Premier Doug Ford said the vaccine supply from the federal government was to blame for his province's current situation.
Would we be in this position if we were getting 300,000 vaccines back in February, like the rest of the world? The answer is absolutely not. We wouldn't be facing the crisis with ICU. We wouldn't be having shutdowns. We wouldn't have the schools shut down. The feds need to get us vaccines. Bottom line.
Let's bring in our chief political correspondent, Rosemary Barton. And Rosemary, help us put the Premier's comments into perspective.
Ian, let's start with the idea that vaccines were going to be the answer to this. It wasn't just vaccines that were ever going to be the answer. What also had to happen were public health restrictions. What Ontario is dealing with right now was forecasted by its own science advisory table all the way back in February. Actually, during the last stay-at-home order in this province, the Ford government decided to go ahead and lift that order, even though it had that modeling and those projections. The Ford government also claims it can administer 300,000 to even 500,000 doses of vaccine a day. It's important to point out the province has yet to even hit 150,000 a day. So the province can certainly fairly criticize the federal government on its rollout. What it cannot say, though, is that it did not know what the rollout would be, the schedule of delivery. And in fact, Ottawa surpassed its delivery schedule for the end of March by 3.5 million doses.
So what's your assessment of what's going on here?
Listen, we're in a very difficult situation for all governments, but for any government in particular who has been maybe a little reluctant to clamp down on further restrictions. It's a problem in Ontario. We're seeing a similar problem in Alberta. Today, Ontario, though, said, listen, we didn't even ask for help when the Prime Minister offered it today. It denied that it had asked for any help. Sources within Ottawa say there was no official ask from Ontario, but there was an inquiry about what more could be done. The political rhetoric is very high. It's going to get much higher at a time when some leaders are trying to justify why they didn't make the decisions they made before now. Today was an example of that, a lot of finger pointing in order to present some cover for why such measures were announced today. And this obviously, Ian, at a time when Canadians are probably running out of patience with some leaders.
And emotions running high, for sure. Thanks, Rosie.
Okay, thanks, Ian.
And the National requested an interview with Premier Doug Ford today. As we have throughout the pandemic, he has not been made available. Well, let's move on to the latest on that vaccine supply that Rosie was talking about. Today, another hurdle, but also some reason for hope. David Cochran explains.
Moderna has struggled to meet delivery dates. Now it's struggling to meet demand. And so, another setback.
Our next shipment will be smaller than expected, and we may see additional delays over the coming months.
Smaller by 550,000 doses as the company struggles to scale production, with a warning that up to 2 million doses due this spring could be pushed into the summer, a setback that will force health authorities to cancel thousands of appointments. A grim start to the day, followed by a quick turn for the better.
Canada has now signed an agreement with Pfizer for 8 million more doses of the vaccine.
That's on top of existing supply and more than offsets the Moderna setback, as Pfizer, after a shutdown to upgrade its facility in Belgium, has been delivering like clockwork, boosting production to double the size of weekly shipments starting in May, ramping up further in June.
But we know that if we hang in there, hunker down, and follow the rules for the coming weeks, as much as we're tired of them, as much as we're frustrated, we have a chance of getting to the summer in much better shape.
If supplies hold, Pfizer alone will deliver enough doses for every adult Canadian to have at least one shot by the end of June. Moderna, AstraZeneca, and Johnson & Johnson will add to that for a total of 49 million doses set to arrive by Canada Day. David Cochran, CBC News, Ottawa.
Pfizer has applied to Health Canada to expand the use of its vaccine to include children as young as 12 years old. Currently, the Pfizer vaccine is approved for those 16 and older, but Health Canada says it's now reviewing a request to expand its eligibility to include 12 to 15-year-olds. The company says the vaccine was found to be safe and effective in clinical trials among that age group. The data, however, has not been peer-reviewed. Despite other supply setbacks, provinces do have a good supply of the AstraZeneca vaccine, but the demand just isn't there because of those concerns about extremely rare blood clots. Even in hot zone provinces, Susanna De Silva shows us the reluctance.
Go for it.
The BC Premier rolled up his sleeve for AstraZeneca.
That's it?
To try and convince British Columbians to do the same.
The AstraZeneca product is safe. I've just had it applied to myself. My wife's slated to get her shot next week.
The province says acceptance of the vaccine has been good. But this Vancouver pharmacist says not so.
I probably have about 40 to 50 doses left.
She still has half of the doses she received on Monday.
Maybe 1 in 10. Yeah. Most people would just say AstraZeneca and just don't want to even continue the conversation. Maybe half of them I was able to get some sort of conversation going.
She says many are worried by the reports of extremely rare blood clots and says some people are opting to wait. It's the same story elsewhere in the country.
But we certainly have seen a significant decrease in the uptake for the remaining amounts of AstraZeneca in the last little bit.
We don't burn through the AstraZeneca so quickly, and we just slowly chip away at what we have.
This Edmonton clinic can give out 7,000 doses of AstraZeneca a day. They've been booking between 500 and 1,000 appointments. Alberta's health officer is encouraging people to sign up.
Albertans between the ages of 55 and 64 are at least 1,500 times more likely to be hospitalized from COVID-19 than experience VIT after getting AstraZeneca.
In Montreal this weekend, trucks with loudspeakers will be advertising pop-up AstraZeneca clinics, but there's worry it's an uphill climb to restore confidence.
It's hard to put that genie back in the bottle. Once you've eroded trust, it takes a lot longer to rebuild it. And I think it's going to take a coordinated effort.
Health Canada said this week as the third wave rages, the benefits of the vaccine clearly outweigh any risks. Susanna Da Silva, CBC News, Vancouver.
The NHL postponed 2 more Vancouver Canucks games today as the team struggles to recover from a COVID-19 variant that tore through the organization.
What do you say to people that think this is just the flu?
Yeah, it's not. It's not something that you want to get, and it's not something that you want to see your family go through either.
Bo Horvat is just one of 21 players recovering from the virus, now confirmed by management to be the P1 variant, first identified in Brazil. His wife was also infected. The Canucks will return to the ice Sunday against Toronto, but the team says 3 or 4 regulars likely won't be ready when games resume. Until now, the capital of Nunavut has been spared an outbreak of COVID-19, but that changed today, with Iqaluit reporting 13 active cases. And as Juanita Taylor explains, the news has put the whole territory on edge.
Iqaluit is in lockdown.
Yeah, so it's a little bit somber. You could tell there's some worrisome. There's a little bit of panic in people.
Wednesday night, health officials confirmed the capital's first case of COVID-19. Today, that number jumped by 12 more cases.
I expect that Iqaluit's COVID case count will rise, so please don't panic when you hear the daily numbers. It does mean that we are identifying cases and able to test, trace, and isolate them.
Officials say exposure happened at this bar over a period of 6 days earlier this month. But the Nunavut government says so far they have been able to trace the chains of transmission.
It is one that we can gain control of, contain, and in time end.
But there's worry for another reason. Iqaluit is Nunavut's hub city. Flights fan across the territory to smaller communities and to the south. The territory's only hospital in Iqaluit has been preparing for an outbreak since the pandemic began. But anyone requiring long-term critical care would have to be transferred out of Nunavut. And it's the best time of the year in Nunavut, spring. That means fishing derbies, weekend trips to the cabin, and tunic time, the annual spring celebration. But this year, it means a lockdown and worry about the worst-case scenario. Juanita Taylor, CBC News, Yellowknife.
Turning now to other news, in the United States, President Joe Biden once again calling for stricter gun laws following a mass shooting in Indianapolis that left 8 people dead.
This has to end. It's a national embarrassment. It is a national embarrassment what's going on.
The gunman was a 19-year-old, a former employee of the FedEx facility where the shooting took place. The FBI says they interviewed the gunman last year after his mother contacted law enforcement with concerns about her son. Police say he took his own life before officers arrived at the scene. Hong Kong media tycoon Jimmy Lai has been sentenced to 14 months in prison after being found guilty of unauthorized assembly. This relates to pro-democracy protests back in 2019. Lai and 9 other activists received jail time or suspended sentences, and it comes as Beijing continues a crackdown on pro-democracy demonstrators in Hong Kong. Tomorrow, millions of people will be watching the final farewell to Prince Philip at Windsor Castle, but only 30 people will be allowed inside. The funeral, much changed by COVID rules, is the culmination of a week of mourning. But as Margaret Evans tells us, it's also been a week of revelations about the prince.
News of a death posted on the gates of Buckingham Palace and across the country just a week ago today. The days since offering a period of reflection for the country on what Prince Philip has meant to it, a man who stood in support but also in the shadow of his queen for 73 years. It is a contradiction that one of the most familiar royal figures has been on some levels also the least known.
There is perhaps a fresh appreciation of Prince Philip, a sense that perhaps we didn't quite assess him as well as we might have done in the last decades.
Historians suggest the sheer longevity of his life means the dynamic figure of those early years is not easily remembered beyond those who knew him well.
I think he'd probably want to be remembered as, as an individual in his own right, really.
The irony, of course, is that it comes with his death.
There's lots of other things that nobody knows about. Everybody's finding out a lot more about what he used to do.
40 minutes to get around the world.
The Duke of Edinburgh was the first royal, for example, to host a television program, and he wrote 14 books on subjects ranging from conservation to carriage driving. There is, of course, much concern for the Queen as she prepares for tomorrow's funeral, the most difficult of days without him by her side.
She will behave with the extraordinary dignity and extraordinary courage that she always does. And at the same time, she is saying farewell to someone to whom she was married for 73 years.
There is a sense here of an almost invisible pillar stood all these years, now removed. Prince Philip's death highlighting the fragility of the Queen herself, maybe even the country too, during this difficult year. Margaret Evans, CBC News, London.
And tomorrow morning, Adrienne will be hosting our special coverage of the funeral. That starts at 9 a.m. Eastern on CBC Television, CBC News Network, and CBC Gem. Next, a very candid conversation about the crisis in Ontario hospitals.
And that is absolutely horrifying. And it is like something out of it's out of a horror movie, quite frankly.
A critical care doctor shares her perspective from the inside, what she fears and what she says needs to happen next. Will childcare be a big part of next week's federal budget?
We gotta take your shoes, wear your shoes.
We look at what a national program could look like. And Nova Scotia's top doctor takes a moment to horse around.
So it was nice to get a little bit of a ride.
The human Dr. Strang meets Dr. Strang the horse. Yep, we're back in.
This week we will focus solely on our progress against the pandemic, and our progress is both frustrating and frightening.
New modelling today presented a dire prediction of what Ontario is up against from COVID's third wave. With disaster looming, the province has announced a longer shutdown, new restrictions, more rules, more field hospitals, and even with all of that, the fear is it may not be enough. We heard earlier in the program from Dr. Callie Barrett, a critical care specialist with Toronto's University Health Network, and we wanted to check in with her again. Dr. Barrett, first of all, what is happening inside Ontario's ICUs right now?
So we're seeing increasing number of patients presenting to hospitals right now who are critically ill with COVID-19, who need to be admitted. And quite frankly, the ICUs are filling up. There are fewer beds available, and we're having to transport patients from one region to the other to shuffle them around to places where there are beds available and there's space. And we're close to the breaking point.
Every morning we see the new numbers in Ontario of infections. They remain very high, and you know better than I do the time lag between people getting infected and those who will end up in your care, in critical care. Are you worried about the next few weeks?
I'm absolutely terrified. We're predicting between 1,000 to 1,200 patients in Ontario's critical care units with COVID-19 by the end of April. And there's not much we can do to change that at this point. So we say that those numbers are baked in, but what we can change is what happens the infections that are potentially transmitted tomorrow. So can't change anything up until tonight, but tomorrow's infections we can change. And quite frankly, the numbers are catastrophic. It's far more than we have the capacity to care for in our province. And, you know, my colleagues and I are really worried about what we're facing.
You're a specialist doctor, a scientist. I know you choose your words carefully when you say things like catastrophic. Do you think there's a danger that Ontario will run out of room in the ICUs?
Yes, I do. I think we're very close to that. And it's much more than just physical space and beds. We'll take the beds, but we don't have enough health care workers to care for those patients. So any given patient in the ICU has many, many, many care providers contributing to their care. And we are already maxed out. We are already struggling to staff our ICUs adequately with nurses. Physicians are being called in from other regions and other jurisdictions to help man the units, essentially. We're already struggling, and we simply cannot continue to sort of flex up. There are limits to how many patients one individual physician and one individual nurse and respiratory therapist can care for at any given time. So no, it's going to get really scary.
You know, those of us who aren't in the medical profession sometimes throw around the word triage, but you actually know what that means. And so once you get to that point, if you get to that point, what happens?
So a triage scenario is our worst nightmare. And it essentially implies that physicians will be deciding among critically ill patients who is going to get the next available bed that is staffed and who isn't. And the people who are triaged to not receive a critical care bed are much more likely to die. And there will be people in a triage scenario who are going to die who, had there been resources available, would have lived. And that is absolutely horrifying. And it is like something out of it's out of a horror movie, quite frankly. And it will be absolutely traumatizing to my colleagues. And I can't imagine the anger I would feel if that was my loved one who got triaged out of an ICU bed because we hadn't done what we needed to do to get this pandemic under control.
You're on a provincial advisory board. You are very aware of the modeling data that has been available to the province. Today, your Premier Ford, said we're losing the battle between variants and vaccines. We're on our heels. As you know, he brought in some new restrictions. But when you hear that rhetoric from the Premier today, what's your reaction?
So look, we all know that vaccines are the way out of this pandemic in the long run. But in the coming weeks, we cannot vaccinate our way out of this third wave. And the only tools in our bucket at this point in time are the public health measures that have worked here in Ontario and elsewhere before. And they're evidence-based and they're science-based. Reduce mobility, reduce contact with other people, adequate ventilation, masks in conjunction with vaccination. And so right now in Ontario, that means we need to close all but essential workplaces. We need to pay for people to stay home from their essential work if they're sick, and we need to protect their jobs while they're away. And we need to be really focused in terms of vaccinating those most at risk.
I know you touched on this, but I do want to ask you directly, how are you and your colleagues doing?
Everyone is doing the very best they can. The fatigue and burnout amongst my colleagues is unreal. And many of my nursing colleagues have quit or moved to other units. It's really dire. It's you know, in one way, we've all come together and there is a sense of camaraderie that was not there before. But on the other hand, nerves are fried and people are tired. And yet we all know what we're coming up against.
Dr. Barrett, thank you very much for sharing your story.
My pleasure. Thank you.
Next, we look ahead to what Monday's budget could hold for you, the first federal budget in 2 years.
We're focused on what you and your family need to get through this crisis.
Ottawa signaled a long-promised nationwide childcare system could be on the table. What it might look like, just ahead.
In the last few days, I've had meetings with all of the party leaders to discuss that budget. As I said to each of them, It's vital that we work together right now.
Justin Trudeau has begun selling his budget early. The minority Liberal government is preparing to unveil its first budget in 2 years on Monday. It's expected to include a full accounting of how much the pandemic has cost so far, as well as a plan for post-pandemic recovery. The government has said a big part of that plan will be a nationwide childcare system. That's something that Liberal governments have been promising for decades. Alison Northcott is in Quebec with a look at that province's subsidized childcare program and what it could mean for a future Canada-wide system.
All right, we gotta change your shoes.
The afternoon routine for Elizabeth Wright and her daughter Elena.
Say bye to everyone.
Wright is from the U.S. and says the subsidized daycare in Quebec was one of the things that drew her here. It costs her less than $9 a day.
It allows us to, be good at our job, advance in our jobs without that added stress of who's taking care of our children.
Quebec's subsidized network of daycares, known by their French acronym CPE, started in 1997. The goal was to offer affordable, universal, high-quality childcare to help more women get back into the workforce.
Women joined the workforce en masse, and by doing so, demonstrated that though the initial investment for the government was high, it basically financed itself.
The federal finance minister recently held up Quebec's plan as an example and has said a Canada-wide early learning and childcare system would be part of the government's COVID recovery plan.
Quebec has the highest participation of women in the labor force with children under 3, not just in Canada, but in the whole world.
Daycare director Georgetta Batog says the kids benefit too. Because she says centers like hers aim to help them succeed and prepare for school. But some say successive provincial governments have opened the door to too many private, for-profit daycares, and there are more than 50,000 children on the waiting list for subsidized spots. Miriam Lapointe-Gagnon started an online campaign to highlight a lack of access for her and other parents.
I was living a lot of stress about the possibility that I might not be able to go back to work in September.
As for Wright, she'd like to see a national program similar to Quebec's in Monday's budget so more parents can have the peace of mind she does. Alison Northcott, CBC News, Montreal.
During a year of reckoning over systemic racism, the Prime Minister promised to tackle anti-Black racism. Now a group is calling on him to turn that into action by boosting support for underfunded Black-led charities. Makta Gebersalasa has more on what's at stake.
So give everyone spaghetti.
When it comes to serving the community, Jean-Claude Mignazamo believes in a hands-on approach.
Today we are serving more than 800 families with the food.
Making these deliveries in his southwest Calgary community wasn't always part of the plan for Umoja Community Mosaic. His charity started out with a soccer program for young people and tutoring sessions, but the pandemic required a pivot, and providing food is just the beginning.
We were serving people already who are vulnerable. We based in public housing. One thing I do every day is fundraising. Every month, we don't know where we're going to get money for next month.
Looking to the future, his hope for some stability lies in the Foundation for Black Communities.
There's really no reason for any community to experience the deep inequities that exist in this country.
Liban Abakor says the foundation is a first for the country, created to give grants to Black-led organizations. With the federal budget set to drop on Monday, the group is asking for $200 million for the endowment fund.
The reality is, philanthropy in this country works based on relationships. If you look across this country, there are over 10,000 foundations. All of them are predominantly white-led.
In a recent report, researchers looked at 40 Canadian foundations and found that for every $100 given in grants, less than 30 cents go to Black-led organizations. Abakor helped co-author the report.
You think about that level of woeful underfunding, it's not surprising then that so many of our organizations that are providing essential services to Canadians, Black Canadians in our communities, were struggling to survive.
But with the spotlight on racial injustice in the past year, there has been a shift.
I think a lot of Black-led organizations saw an outpouring of support. But I know many leaders like myself are also holding our breath because we don't want this to just be a trend.
Finding ways to keep the funding coming is always on the mind of Eugenia Addy with Visions of Science.
I wanted to be a doctor.
The organization delivers STEM opportunities to kids in marginalized communities.
We know, even as a result of this pandemic, how important science, technology, engineering, and math is and how we engage every day.
But she says early on, it was a struggle to get support for the cause. A foundation to help fund Black-led charities could have made all the difference.
We're able to achieve an impact that others can't because we're there. We've lived this, we understand.
So does Minyazamo and his team, and you see it in every box of food, culturally tailored to satisfy each family.
This family either from Ethiopia or Eritrea, because there is a teff and the berry. You know that's food to make anjera.
Recognizing a need and meeting it. That's what he's hoping the government will do on Monday for Black-led charities like his. Magda Gebrselassie, CBC News, Toronto.
Next, the key moments in the trial of the former police officer charged in the killing of George Floyd.
That's never happened in American history.
As the jury prepares to begin deliberations, we take you through the evidence and the arguments. Welcome back. Closing arguments are set to begin Monday in the trial of Derek Chauvin, the former Minneapolis police officer charged in the killing of George Floyd. Then the jurors will deliberate as the world waits. Susan Ormison takes us through the arguments laid out by each side.
In just a few words,
I will invoke my Fifth Amendment privilege today.
Derek Chauvin confirmed he wouldn't testify and the evidence rattled. After 38 witnesses to convict, the jury must be persuaded of one key thing.
That Chauvin's conduct was a substantial contributing factor to Floyd's death.
Ted Samsel-Jones is a law professor in Minnesota.
I think the prosecution built a very strong case from the beginning. First part was having the eyewitnesses testify, which was of course very powerful.
Please don't shoot me, please, man. It was always going to be about the videos, played over and over in court, stirring up painful emotion.
Oh my God.
Those who witnessed Floyd's death told jurors they still suffer, like the teenager who took that viral video.
It's been nights. I stayed up, apologizing to George Floyd for not doing more.
Prosecutors set out to prove Chauvin used excessive force outside his training, and his boss, the police chief, concurred.
Once Mr. Floyd had stopped resisting, and certainly once he was in distress and trying to verbalize that should have stopped.
That's never happened in American history. We've never seen a police chief testify against one of their own.
Secondly, a suite of medical experts, including a pulmonologist who testified with certainty that Floyd died from low oxygen caused by Chauvin's weight on his neck and back.
With each breath, he has to try and fight against the street, and then he has to try and lift up the officer's knee with each breath.
The defense strategy was to hone in on Floyd's heart disease and drug use.
They were significant, or they contributed to Mr. Floyd having a sudden cardiac arrest.
It's possible here that the defense is not necessarily aiming for an acquittal, but at least enough to cast doubt to get at least one juror to say, I'm not sure, I have reasonable doubt.
That's all it will take. One juror to doubt, which could result in a hung jury. But Samsel-Jones thinks that won't happen.
A verdict, and it's overwhelmingly likely that the jury will come back with a verdict of guilt on at least one of the two murder counts.
11 months since George Floyd was killed, the jury begins deliberations on Monday.
So, Susan, there's a range of charges the jury will be considering. What are the implications of that?
Yeah, remember the jury has to decide a verdict on 3 charges, with manslaughter being the least severe and second-degree murder the most severe, and in between there is third degree, which the prosecution was able to add, hoping that that may come between those two and they may be able to get a conviction there.
And of course, there was just a police shooting in the state of Minnesota, and you know, you wonder what impact that might have on the jury.
Yeah, I mean, the judge has been telling the jury, don't listen to the news, but that's near impossible given what's happened in the last week in the Minneapolis area. And you know, there's 2 trials here, one inside that courthouse with Derek Chauvin charged, and one is a trial about policing in America. And in the street, people are looking for a conviction on all 3, but of course, it's a jury and they'll decide.
Okay, Susan, thank you.
You're welcome.
Up next, they lost their little boy. Then, to make matters worse, they were blamed online for his disappearance.
It changed me as a person altogether, just that alone.
A family's legal battle to stop the vicious online attacks and their determination still to find their son. Welcome back. 3-year-old Dylan Ehler went missing nearly a year ago. And over the past year, his parents' grief has been compounded by a campaign of cyberbullying. They've been accused of negligence, even murder, despite police saying there is no evidence to suggest that. Now the family has turned to a new law, hoping to bring an end to it. Here's Kayla Hounsell.
If you're happy and you know it, clap your hands.
This is Dylan Ehler about a month before he disappeared last May. He had just turned 3. When he went missing, he was in the care of his grandmother, playing in her backyard. Only his boots were found, one in a nearby brook, the other further downstream. Police say there is no evidence of foul play. But ever since, Dylan's parents have been targets of vicious online attacks, even directly blamed for their son's disappearance.
I think originally people wanted to put awareness out for Dylan. Then rumors got twisted in there with facts.
Multiple Facebook groups were set up after Dylan went missing with thousands of members. The cops know it's the mother but need evidence, said one unfounded claim. She killed the kid, I heard through the grapevine, said another.
It changed me as a person altogether, just that alone.
Now, this lawyer has taken on the family's case pro bono, hoping to use a new Nova Scotia law to help them. The cyberbullying legislation was enacted after teenager Rehtaeh Parsons died by suicide following online harassment.
We're hoping that a court will order that certain individuals are not able to post, not able to make these posts.
We opened that group purposely to look for Dylan, not for hate.
2 of those individuals controlled one Facebook group where false allegations were made. They shut it down, but they don't want to stop making posts about Dylan in other groups.
We've been into her from day one. For them to actually tell us that we have to do this, that's not right.
As the cyberbullying case makes its way through court, the family continues searching for their son.
Losing a child is one thing, but the unknown is way harder.
Surrounded by Dylan's favorite things, they are marking his 4th birthday today. A reminder of a terrible loss, compounded by a relentless stream of horrible accusations. Kayla Hounsell, CBC News, Bible Hill, Nova Scotia.
When we come back, an honor for Nova Scotia's Chief Medical Officer of Health and a meeting months in the making. That's in our moment. Earlier this year, a Halifax horse riding school voted to bestow Nova Scotia's Chief Medical Officer of Health with a unique honor by naming one of their horses, Dr. Robert Strang. So with the pandemic on, Dr. Strang is certainly saddled with responsibility, but he took a moment today to meet his namesake, and that had to be our moment.
He's a very nice horse, very calm. It's been a really hard year or more, but these little things, everybody have a bit of a laugh. helps us all. I'm very appreciative of it, and it was nice to have, it's been a year since I've been on a horse. It was nice to get a little bit of a ride. An activity like riding is an important part for kids to have in their life, and having this in the middle of the city. So I just think it's wonderful, and anytime I can support or just be involved with a little bit, it's things like this which actually build strong communities and connect people. I'd sure love to come back and visit. I talked about coming back at some point, just having a visit, and now that I know who he is, he's with the biggest dark-colored horse so when I drive by and see them all out in the paddock here, I'll know which one is Doc.
So apparently his name was in the lead for this naming contest right from the beginning. And a couple of the other names that got a lot of support, Zoom, perfect name for a horse, don't you think, at this time, and the obligatory Horsey McHorseface. That is the National for April 16th. I hope you can join me on Sunday for Cross Country Checkup. That's on CBC Radio, and it starts at 4 p.m. Eastern, 1 Pacific. And then later on, I'll be back here for the National. Good night.